Hey guys, hi, welcome to my channel. Woohoo! So, I'm a bit long-winded sometimes, but I'm gonna try my best to like get into everything. So pretty much I wanted to make a video about my whole IVF process and how everything goes, how it's going, what was and what is. So, I just wanted to invite you guys, and then one of the things that's significant is that I really wanted to put a focus on people that may have mental health issues. I don't want to say disadvantages, but things that happen in life and you have to deal with, but you still want to have kids. You still want to fulfill that, and you can. So yeah, that's what this is about. So welcome, welcome, welcome. We will get right into it. And we'll just kind of talk about the depths of everything. So I'm really detailed. So I'm going to make sure that like I put in the link, like what I talk about and like what time. So you can kind of skim through if it's a little bit too much, but I appreciate you stopping by, and just watching. So please, 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 before we continue, if this is something you feel like you want to hear, please subscribe. And then also make sure you hit that little thing there so you can get notifications when a new video comes up. I think it's like a bell or something. I can't recall. But anyway, you guys know what I'm talking about. YouTube is not anything new for you. So yay. So we're going to get into it. Okay. So yeah, you guys, today I just wanted to talk and kind of go into everything. So for one, my biggest focus is really sharing as much content as I can about this entire IVF process, the journey, what it will be like, good, bad, ugly, the beautiful, the stuff they don't tell you about, all that. And then also tell it from a perspective of somebody that deals with like mental health issues, and also like different body issues. I've struggled with issues with my back for years. I've also, like been diagnosed with PCOS. And then on top of that, about 5 or 6 years ago, I was diagnosed with bipolar depression. And then I was also made aware that I have like ADHD and anxiety attacks, and they all kind of go hand in hand. So I can't say that I was fully shocked, but I can't say that I was like fully like, oh yeah, absolutely. I guess the hardest thing for me to gauge was, what's really normal and what's not. Like at what point do you really go to the doctor? Clearly when I went was the point for me, but I wish I would have known sooner, because there was a lot of highs and lows in my life that I probably could have dealt with in a much easier manner if I was aware of what was going on with myself and the things that I was dealing with. So since then I have tried like a million different medications and all that. But prior to this, I have to say that I weaned myself off of all of my medications. So I was taking one for the bipolar itself, then one for like the depression, and then also for ADHD. And then I had my backups for like an immediate panic attack. And then I was also taking something to sleep. So every single one of those I pretty much weaned myself off of, which was not easy. And I advise anybody not to just do what I'm saying to do. I'm not even telling you to do this. I'm just telling you about my personal story and what I've done so far. And that was something that I discussed not only with like my doctor, but I talked to my husband as well, because anybody who already knows, the people that you're around, you live with, who you deal with on a normal basis, especially, that matters. The way your behaviors and the things that you do, your mood swings and, the insomnia and everything, all that plays a major role in life for yourself and for the people surrounding you, your job, all of that. So it's always good to talk to some trusted people, just to, kind of gauge like everything. What's the best thing to do. So, so after talking with my doctor, talking with my husband, that was something that we decided to do. And I really put a lot of implement on different things to help my life. So I definitely upped my exercise. I definitely did more meditation, try to figure out more practices that help and calm me down. And I think things have been okay. So I don't think it's been horrible. My worst part, honestly, like the worst experiences that I've had this far was when I went and got diagnosed. Things were so bad and I was in such a mentally screwed up place. And my phone is going off, y'all, so I apologize for that. But yeah, that was probably the worst of it. So yeah, but anyway, to keep on moving, so that's something that I deal with and cope with. And if you guys want to know more about that, because I know the details really do matter, down to how you react and everything with the meds, off the meds, the stress that puts you under, then let me know below in the comments and I'll make a video just for you guys, because that is a really big deal. But I don't want to spend a whole lot of time on it just for this video because there's so much more to talk about. So moving on to that, the PCOS, of course, that's the big ha 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 thing, you know. Of course, anyone can do IVF, but there's a lot of women that go because of things like PCOS, which is polycystic ovary syndrome. And for those of you who don't know, it's like these little cysts, they're just all over the place, and they're just creating problems hormonally, and everything that you just don't know affects you as much as it does, you know. At one point I thought I was really crazy, and then when things started to regulate, I realized I was a normal person. I wasn't that bad. I wasn't that moody. I wasn't that sad. It didn't trigger my episodes as much. So you would be surprised at how many things contribute to your body, and how the lack of, and the things that happen because of PCOS. So when you really, really look at it, be like, oh my gosh, you know. So also I had my diabetic scare, everything. I gained weight, all of that good stuff. And luckily all those numbers are back down, so I'm good to go. Which that was one thing I wanted to do first as well. I was like in pre-diabetic for a while. So I worked really, really hard to get that down, and I'm into the normal levels. So that was just something I was a little concerned about, because if I'm pre-diabetic now, definitely I would have that gestational, hopefully I said that right, diabetes, like in pregnancy. Like I'm pretty sure that would be me. And I just didn't want to put my body and also like the baby in stress, you know. So my phone is going off, y'all. Like, hold on, y'all. It might actually be my man. I'll be right back. Ooh, okay, so I'm back. Was not my man. False alarm. Anyway, so that's what I was saying. I cannot talk right now. But so the whole PCOS thing, you know, was crazy, but I've been dealing with it, and I was diagnosed around the same time as the bipolar depression, because I was not a doctor person. I just didn't want to go. I was always in the hospital growing up because I would have ovaries on my cysts that would rupture, and I would not know until they ruptured, and I was in the hospital for weeks. So yeah, by the time I got older, I didn't want to see a doctor. I just didn't. And I just, you know, believed that everything would be okay. And guess what? Everything is still okay. But I have more resources because I went to the doctor, because I know more about myself and what I can do to counteract the things that are going on. So to get into this process, last year, I want to say, yeah, it was about a year ago. We went in initially and we're like, you know, we're going to really, really start trying. Me and my husband, we've been together for almost 12 years. We got a few months, and it'll be our 12-year anniversary that we've been married. And never have we used any kind of protection, any of that stuff. So to never hit the mark, never have a scare, never even have like a miscarriage, nothing, you know, it was a big deal, and it was very disheartening and scary, and we went through our things, and that's a whole nother video that I will definitely talk about, because that is a real situation. Okay. But yeah, so we went and we're like, okay, we really, really need help, you know, beyond me being, because I wasn't regular, like it was just bad. And I never believed in birth control, so it was just a whole thing. So anyway, we went, and The doctor's like, well, like, let's try you on the typical meds to just regulate you and just see if you do it on your own kind of thing. I was like, Doc, let's just do this IVF straight up out the gate. Like, I want babies now. Like, I'm not getting no older. Like, let's do this. He was like, okay, like, let's not be so rigorous on your body today. Take your time. It's okay. Let's do some testing and all that. Because I'm like, let's do it today. Like, he can go in a cup. Like, let's go. But it doesn't work like that. And definitely, like, if your insurance pays for it, it does not work like that. Okay, like, you got to have some reasons as to why, all that stuff. But anyway, and financially, all that stuff is a whole nother video. So if you want to know more about that, put in the comments so I know. But yeah, so when I went initially, me and my husband, I went and did like initial consultation. He put me on Provera, and then Clomid. And then I was like taking a trigger shot. So the very first month that I did that, the Provera, whatever you want to call it, which is like progesterone, that was to induce my cycle because it was so irregular. I wouldn't see it for like months. Maybe, like 4 months would pass by before I see one. And then when it comes on, it could be like for 2 days, which is not normal for me. I'm like a 5-day girl. Or it would be on for a month or 2 months or 5 days or 7 or 2 weeks. It did whatever I wanted to do. Literally. It was like, girl, you don't run nothing here. So, the Provera, it worked very well. And I responded well. Cycle came on. I took the Clomid, took the trigger shot. First month I got pregnant. So we were like, woohoo, that didn't take much. I needed just a little bit. And I was doing okay, but my numbers were looking a little iffy. Like I wasn't really producing as much of the HCG hormone as I should have been. So they were like, we're not really sure what's going on. We just want to make sure that the baby, that it's going to be healthy, like a viable pregnancy, that it's not like stuck in your tubes or anything like that. Then my numbers started to go up, which was really good. And they're like, okay, they're starting to double. And then I got this really, really sharp pain. Like it was like maybe, I don't know, like 4 in the morning. And I was in so much pain. I couldn't take it. I mean, I could barely get up. And I had felt this pain before. So sure enough, it was my ovaries acting crazy. I had a cyst on my ovaries that ruptured. So the same thing that happened, as I was growing up, happened here. So I went to the hospital because I was so nervous. My husband was freaking out. And this is also during COVID, so he could not be there with me. So it was like scary by myself. I was there for the whole weekend. And, so it pretty much ruptured. And by the end of the weekend, I lost the baby. So I had a miscarriage. I just still say baby because, for a day or 2 or a week or 4 weeks, I think I was 7 weeks before the 7 weeks before the miscarriage. So, but anyway, that happened. So we tried, on and off. I didn't stick with the regimen. Like for the first, because it took a while for my body to get like back regular. He didn't want me to just like hop right back on the meds, have a little bit more time to heal. Because, they wanted to make sure they didn't have to do like any surgeries or anything because I was like internally bleeding out and stuff. But all was well. I'd say maybe about 4 more times that year I did the medications, and maybe 2 out of the times I did trigger shots and no success. And we went through a lot. Like I said, we didn't know if we should still pursue it because of COVID. Then my husband started working out of state for a while. So there was a lot of little factors, that led to why we just didn't keep it consistent. But, this year I was like, babe, I just want to go all the way in. Like we've been trying and I've lost more weight, and it's just, I want to just straight up do IVF. And he's like, all right. He's down. He's ready. Super ready to be the amazing dad that he will become. So, we are pretty much caught up to the now. So I did my IVF, ready to go, file the claim, all that stuff, ready, session, consultation, whatever. So I have been into so many little things with this, but I'm not letting it discourage me. And I'm just looking at it like it's a journey, it's a challenge. And, I have a story to tell my little one when they come. So, the doctor's like, okay, great. We're going to do a prep cycle. And then after that, we're going to just jump right into things. Sounds good to me. Although, once again, I was like, Doc, we're going to do this today. Like, this meeting correlates with my timing, inject me. Let's do what we got to do. But once again, it doesn't work like that. So, excuse me. I was waiting on my cycle to come because since I had been doing the Provera, and I didn't do it every single month, but since I've been doing it, my body had been pretty regular and on time. I mean, I had my little app and it would tell me when, and I mean down to the day it was on and popping, and it'd be gone and out of there. By that 5th day, it's gone and good to go. So the last month was the first month out of that whole year it does not want to show up on time. So I'm like, really? Like, we've been doing so well, and you want to cut up right now? Like, great way to show me we're going in the right direction. So anyway, I called them, and they're like, I'm like, it still is not on. They're like, oh, really? Okay, Provera it is. So back on Provera. So I finished that. Cycle came off, but there was some spotting that remains still, right? And I'm just like being honest with you guys. So I got a little nervous because that doesn't happen either. Now, I do want to say that my regimen is Provera to push the cycle on. Once my cycle started, I was to take birth control, which is like the Allison, and then metformin and baby aspirin. And then he did some blood work, and actually, like, my thyroid, it's okay, but he wants it a little bit lower. So it's nothing to really be alarmed about, but he was like, it's just better if it's down. So I have started taking something for that, like levothyroxine or something, which I'll put it all below so you guys know exactly what it is. So I take all of those, and I started the levothyroxine like way before my cycle, even started. And that's really good to see if that like interacts with like an irregular cycle, because I wonder if that was like a trigger for something. But anyway, like I'll go through that later. But yeah, so I started all of those, and I didn't know if it was like the birth control or whatever. I talked to my doctor, and they're like, well, it can happen, and the fact that it's extremely faint is nothing really to worry about, and it may never stop until your next cycle. So today I have like a few more days left until I stop taking the Allison. Tomorrow I have an appointment where they're going to do some additional testing. And I am so sorry, you guys. I thought that I brought like my little book over here that has like the name of the test, because I can't remember. I can't. So, yeah, but anyway, it's like a prep. So one of them, they're pretty much gonna do a little prep of extracting just to see if everything's okay. And then the other one, they're just like, it's almost like an ultrasound about ovaries, checking and seeing like where I'm at and all that. So, but I will put it below what it's actually really called, because that's kind of horrible to do a video and not know. You know what I'm saying? But y'all get what I'm saying. Anyway, so that is the step that I'm at right now. And I'm just waiting. I'm excited. As far as like my highs and lows, I've been severely tired. I can say that. And I don't know if it, I don't know what it is, the medications. I don't know the lack of what I'm used to taking for so long. But, yeah, I'm tired often. It's a little difficult to get going. I'm very used to what I was taking to really help me out with my ADHD and all that. So the push from just myself is difficult. But, you know, I want to try it this way. So that's where it's going. So far, so good. So yeah, I will make more videos, you guys. I'll probably do like at least 2 to 3 a week. That sounds like so much. But I just want to make it as like transparent and open as I can. So you guys see this video. The next one, I may have no makeup. My hair may be looking a hot mess. And y'all might be like, is this the same girl? And yes, it will be, okay? But you're gonna catch me on different days, okay? Different person, different days, different moods. But I'm showing you all of that because that shit really matters. And I'm not the one to keep up the appearances like the Joneses or whatever you want to call it for the sake of online. No, I'm going to tell you like how it really is real life. So you guys ask me whatever you want. And, you know, leave stuff in the comments, man. So I'll respond, make videos, all that good stuff. But I appreciate you stopping by. I'm sorry if it was like way like too much talking and likes and ums, but that's just who the hell I am. Okay. 1, I'm a Leo, dramatic. For 2, that's just who I am. And you know, these are my early videos. So that is it for now, you guys. I'll definitely have more info soon. Probably like after the doctor's visit, you know, that update. But I do want to say that the next thing to come up is my cycle will start again, like next weekish. Speaking it. And during that time, that's pretty much go time. You know, once I get on, they do testing. As soon as I'm off, I am straight up doing injections and doctor's visits. And I do want to say, get your meds as early as possible. Because who I went through, they had to ship them to me. And UPS delayed it because it was like UPS Air. So it was supposed to get me like the next day. They delayed it. Sent me a message saying at the receiver's request, return to sender. I paid a little too much to be returning. Okay, that's not what happened. So after I had a beautiful call with them, and then I just talked to, you know, the actual like pharmacy that I deal with or whatever. They were like, we'll just resend it. Problem solved. But for me, it was like a whole thing. So I wish I would have called them first, but oh well. So yeah, so just please get that early because I cannot imagine if it was go time and I did not have that. That sets things back, man. And especially if you're trying to time my baby, or you know, you're really into astrology like I am, and you're kind of trying to see when you'll have your baby and what you'll have. But anyway, that's a whole nother topic for another day. Anyway, you guys, I'm out. I got some stuff to do. My dog is crying. I'm driving me nuts. And yeah, that's about it. So I'll talk to you soon. Thank you so much, you guys. It means a lot that you just come by and listen. Bye.